is a pleasure to be here, and I too want to just acknowledge the insanity of the cuts that have gone on in childcare. There is absolutely no rationale for taking money away from the most vulnerable in California to take care of the kids. Insane. So my presentation today is really on the premise that the time will come when you have the funding that you need and you can turn to some other issues as well. And the issue that I've been working on for the last 10 years has been the childhood obesity epidemic. And there's now some new and very powerful data about some of the causes of the epidemic and what kinds of things that we can do about it. In particular, sugar-sweetened beverages, sodas and other sugar-sweetened beverages. So let me make sure I don't go over time and get started. California Center for Public Health Advocacy, we were established 10 years ago specifically to establish policies at the state and local level to promote the public health. As Phyllis described, we worked for many years on school nutrition standards with Phyllis and many of you with California Food Policy Advocates. We then worked for a year getting some additional funding for physical education at the elementary school level. We then got menu labeling passed. I just went to the theater the other night, the movie theater, and there was nutrition information at the movie theater. How many calories do you think there are in one of those large popcorn? I didn't know. It was only 1,000, 800 or 1,000, something like that. So lots of changes like that. And now we're spending a lot of time working on soda. So let's talk about that. Our tagline is, because health doesn't just happen, we need public policy changes to make sure that conditions are right in communities so that people can be healthy. So I'd like to talk about just very briefly the obesity epidemic from a public health perspective, the critical role of public health policies, and then why sugar-sweetened beverages. How many of you have seen these maps more than 1,000 times? Yeah, how many more than 10,000 times? So I like showing them, even though I've seen them at least that many, because there is no way to see how the changes in obesity rates in the United States have happened. There's no way of looking at these and imagining that this is all about personal responsibility, right? There is something going on here that's causing these dramatic changes. In my adult lifetime, obesity rates in California have gone up. So in 1985, I was, don't tell, I was in college. No, I was graduating. So in my working lifetime, obesity rates have gone up from 9% of Californians to 24% of Californians in the last 25 years. Crazy. We have indeed become the United States of obesity. My favorite political cartoon, and I collect them, is Noah on the Ark saying, "Hey, who let the Americans on board?" And then you'll see in the bottom right-hand corner, there are a couple people floating in the water saying, "Hey, is there a McDonald's around here?" I love that. So among kids, obesity rates have increased fourfold in the last 40 years. 50% of overweight 3-year-olds will become obese adults. So the populations that you're all working with, as with so many other things, that's where health or ill health begins. So what's happening to create all of these changes? And what's happening with the technology? So I see it on my screen. Oh, you know what? My red doesn't show up on that screen. So what's happening here? Has there been big genetic changes in the last 40 years? We learned a lot about genes, but it's not that. Do we have less willpower, or are we less informed than we were 40 years ago? We are wildly more informed. Or have we built a toxic environment? Yeah. So think about how things have changed over the last 40 years. There is now junk food everywhere. Portion sizes have all gone up dramatically. We spend $10 billion a year advertising soda and junk food to kids. Actually, I just heard Kelly Brownell from Yale say that RWJ has invested $500 million in obesity prevention. And what they spend in 3 days, what they spend by January 3rd, the food industry, what RWJ is spending for an entire year, the food industry spends just in advertising by January 3rd. Right? It's not exactly an even playing field. Food access, big problem with food access. In many communities, it's as difficult getting healthy food as it is for any of us who have tried to get something healthy if you're driving from Sacramento to Los Angeles, right? Drive from here to LA, and what's there? That's what it's like in a whole lot of communities. The Institute of Medicine has said that it is unreasonable to expect that people will change their behavior easily with so many forces in the culture, in the social, cultural, and physical environment conspire against such change. I like to say that we've been involved in a big experiment for the last 40 years. When you change the environment dramatically and lead to equally dramatic increases in obesity. And the science is in, yeah, we can do it. If you change everything, you'll see those effects. And the extent to which it's the social, cultural, and economic factor, that's the extent to which public policy plays a role. Because that's the role of public policy, is to address all of those things that are outside of individual control. So given that context, let's talk about sugar-sweetened beverages. And when I talk about sugar-sweetened beverages, I don't just mean Coca-Cola and soda, but I do mean those. I also mean sports drinks, iced teas, energy drinks, now vitamin water. So in order to get your vitamins, you got to drink all of this sugar, right? It's good, it's colorful. Yeah, right. Some reasons to focus on what we call sugar-loaded beverages now. Turns out that sodas are the single leading source of sugar in the U.S. diet. Every 20-ounce soda has 17 teaspoons of sugar. Imagine eating 17 teaspoons of sugar. I'm on 5, 6. Imagine eating 17 every time you drink a soda. It's like drinking a piece of chocolate cake, right? It is consumed in massive quantities. So as we've started doing research and advocacy work on this, some of these numbers are startling. Adult consumption of soda in California. The average person drinks 50 gallons of soda a year. That's the equivalent of 39 pounds of sugar. That's how much my son weighed when he was 5 years old. So the average person drinks a 5-year-old of sugar every year. Kids drink a ton of this stuff too. Kids aged 2 through 11, 41% drink a soda or more a day. 62% of teens. And the youngest kids, ages that so many of you are working with, 33% of kids aged 2 through 5 drink a soda or more per day.